Hello, everyone. Some of your school nurses have teamed up to explain a few things about new items you may observe people wearing when you watch television, go to a doctor's office, when you visit your school campus to pick up your lunches, or anytime you're out in public. On a normal school day, when you go to the nurse's clinic or when you visit your doctor's office, you would observe your nurse to look like this, wearing their regular scrubs or maybe even your school spirit shirt. What you may be noticing now is that your nurse or other people out in public may look like this, wearing a special mask on his or her face. These face masks may be all different colors and designs, and some may even be homemade and look like this. Most masks are made with multi-layered fabric and have bands that hook over the ears. They are designed to provide a physical barrier that prevents the spread of germs from person to person. Wearing a mask helps to make sure that you are not breathing in other people's germs that may be in the air. It can also prevent other people from breathing in your germs if you are sick. Lately, you will also notice that some people are wearing gloves. When you put those two pieces of equipment on together, people may look like this. Gloves are really meant for healthcare workers, but most people you see in public are wearing a regular surgical mask with gloves on their hands. Gloves create a barrier between germs and your hands. When wearing gloves, germs stay on the gloves instead of getting on your skin. Masks and gloves are being used to protect you, your loved ones, and healthcare workers from getting sick and avoid passing germs to one another. If you're visiting a doctor's office or hospital, it is common for the healthcare workers to look like this. The gown is another protective measure that is being taken to help prevent germs from getting in contact with our clothes. Again, this is just to keep you and I healthy and to avoid passing germs to one another. It may appear a little scary, but there is no need to be afraid. Underneath all the equipment are your friendly, smiling nurses. Hand washing is probably the most important thing you can do to protect yourself from getting sick. It is important to wash your hands immediately after you cough, sneeze, blow your nose, or if you've been out in a public place. Always avoid touching your eyes, nose, and mouth with unwashed hands. Washing your hands is simple. First, turn your faucet on using warm water if possible. Wet hands with water and apply antibacterial soap. Lather your hands with the soap and don't forget to scrub up to your wrists, the back of your hands, in between your fingers, and under your fingernails. Make sure you scrub well with soap and use friction for at least 20 seconds. Rinse your hands with water and dry them using a paper towel, a clean hand towel, or an air dryer. NEISD Nurses Care.
NEISD Nurses Care.
NEISD Nurses Care.
And we're here for you.
We're here for you.
We're here for you.
We're here for you.
That's what I'm talking about.